Hi everybody, it's Amy again. This is Bro, my dog. It's like my co-pilot in life, my best friend. But anyway, I posted a video last night about my situation and my upcoming experience with getting a full set of upper and lower dentures. And honestly, I didn't think anybody was going to see it. I didn't think I posted it. I really wasn't expecting anybody to watch it or anyone to see it. And by the end of the day, I had over 100 views. And that was really cool. Like, it meant a lot to me that people actually care about what's going on. I've been watching a lot of videos from other women who've been going through the same thing, and their videos really meant a lot to me. I mean, they helped me out so much just seeing what they went through, how they were feeling, and also just knowing that there were other women out there who, were about my age and going through the same thing I am, because I've heard nothing but, negative comments from other people telling me, it's a big mistake, you're going to regret this, and, you're only 27, you're so young, you don't need to have dentures. But, it's not like it's something that I've just decided on a whim. It's something that I know I need to do. I've got cyclical vomiting syndrome. I've been suffering from it for years. Not a whole lot's known about it. But basically it's, once a month, and for me, mine's triggered by my menstrual cycle. So every month when I have my menstrual cycle, I go into these horrendous fits of just nausea and vomiting where there's nothing that stops it. It starts and it doesn't stop. It's really embarrassing. I've been around, it's happened at work before. It's happened, around my friends, and nobody knows what to do. Everybody's just, it's really embarrassing. They all just, are kind of in awe, and I'm retching and I'm making horrible noises and I'm throwing up nothing but this horrible stomach acid and blood. And I've been admitted to the hospital for up to, a week at a time, on several occasions. Like I said, it happens every month. I've been taken out by ambulance. Sounds dramatic, blah, blah, blah. But anyway, because of this disease, my teeth have gone from what I like to think used to be, a beautiful smile, and, something I was comfortable doing in front of everybody. And within a short period of time, it's turned to this. I'm going to show you guys. This isn't something I show many people, but I'm going to show you. Don't be afraid. So this is what I've got going on. The webcam doesn't capture it very well, but as you can see, I'm missing this tooth. I got a nice little nasty snaggle tooth there. The roots are on the gum line. Ow, sorry, that really hurts. The gum line of these two, and all my other teeth are just rotted away. It's a very aggressive decay, from what I've heard from the other dentists. Missing that one back there. Missing some down there as well. I'm trying not to talk with my fingers in my mouth. Also down here you can see it's just really embarrassing, and it's gotten that way so quickly. It seems like it wasn't that long ago that I had my beautiful smile, and this has just happened so quickly from the acids and all this that's happened. And I know that this is going to turn horrible really quickly. This is going to go any day now. And then I'm going to have some Bugs Bunny teeth. And what makes my Bugs Bunny teeth worse, is I got a hole going right in the middle of them, and it's always worse in the back. You can tell it's from my vomiting, because it's always worse on the back side. Anyway, you've seen enough. But yeah, I know it's not going to get better. And this decay, there's nothing that'll stop it. Once this starts, there's nothing that's going to stop it. And I just know that it's going to keep getting worse. And it's killed my confidence so much so far. And I know this isn't as bad as some of the other ladies that I've seen, watching other YouTube videos. It's not as bad as some of the situations that other women have going on. But it'll get there really quickly. And I really want to get it taken care of. I want dentures. This isn't something that I haven't thought about, or, it's not like a whim decision or whatever. It's something that I've given a lot of thought to, and I know that life isn't easy with dentures, but I want them. I do. And, since my condition is recurring, it happens every month, it's, even if my teeth were worth saving, I've got two here on the bottom. those two in the middle are still in relatively good shape. But I know they won't stay that way for long, because every month this happens again, and I'm in the hospital and I'm throwing up, and it's like I said in my last video, it's not like, oh, I got a hangover, man, I'm gonna puke for a few hours until I eat some McDonald's and then my hangover will feel better. And it's not like I've got the stomach flu. It's just, it happened, and there's no stopping it. And once there's nothing left to vomit, please excuse how gross this is. I just keep vomiting. It's this horrible stomach acid and just blood. Honestly, it's really, really gross. But, the blood from just, the tearing at my esophagus and the tearing up of my stomach, it's almost like my stomach's trying to turn itself inside out, kind of is how I describe it. And being, I have to go to the hospital every time. And a lot of times I'm treated as a drug seeker there, or a lot of times doctors don't know about it, and they kind of, seem like I'm making it up. There's a certain cocktail that works for me. For me it's IV fluids, Zofran, Phenergan. Usually they give me Reglan too, and then Dilaudid, because the Dilaudid, it helps with the pain. It's not an easy experience. It's super painful. It's horrible. And the Dilaudid also helps. It kind of just knocks me out for a while, and it just almost relaxes me in a way that I can't do when I've got my attacks. Anyway, so as soon as I mention, I mention drugs by name, I mention the Phenergan and the Zofran and the Dilaudid, I'm instantly labeled as a drug seeker, and that's not the case. But, boo-hoo. This isn't a video about cyclical vomiting syndrome. Anyway, I know that there's no saving these teeth, because it's going to keep happening. But I'm really excited. I'm going to be going to the Affordable Dentures Clinic in Springfield, Oregon. I've heard a lot of good things about them. I've also heard some pretty bad things, which honestly are kind of scary. But I'm going to be going to see them because they're so much more affordable, hence the name Affordable Dentures, than most other places. And they can do it, same day. So I'm going to be going in on the 25th. Excuse me, I can't speak quite well. My missing teeth and whatnot. I'm going to be going in on the 25th, and I'll be going in the morning, and they'll take my impressions, and they'll be fitting me for the dentures. And then I'll leave, and I'll come back later that afternoon, and they'll apparently have my dentures ready for me, and that's when they'll do the extractions and take all of my teeth out, all of them, which, I'm really scared for. Sometimes I can be kind of a wuss when it comes to pain. I don't know. Pain sucks. Nobody likes it. So I'll be going in. I'm not sure what kind of sedation they'll use. I'm also really, really nervous because I have a history of high blood pressure, and I know for a fact that if you go into a dentist, wanting a procedure, or expecting a procedure to be done, and you have high blood pressure, sometimes they won't do it if your blood pressure is too high, or they will one of the last dentists I saw actually sent me away and said I needed to have something signed by a doctor before I'd have it I could have my procedure done. I'm starting to ramble. I apologize. I talk a lot. Anyway, so I'm really nervous, but I'm really excited, and I plan to document my whole thing. My mom's, she's kind of nauseated by the whole thing, but she'll be coming with me to have my procedure done, and I'd like to have her document as much as she can, because I don't know about you, but for me, it's been really helpful to see, even as nasty as it is, or as scary as it is, it's really nice to see exactly what to expect. So I'm going to be doing that, and I hope you guys will stay tuned for it. If you have any questions or whatever, please feel free to just message me or comment, and I'll be happy to answer any of your questions. But other than that, please just wish me luck. Maybe stay tuned and follow me in this whole adventure to get my dentures done. And I'll keep you all posted. So I guess that's all. You guys have a great night.